Hey, this is Marcus Green. I'm back this month for another installment on my YouTube channel, my series that I'm doing on Medicare, which is directly affects baby boomers. So if you haven't seen my video, please share this, subscribe. There's a lot of people who need this information, who are turning 65, who are becoming Medicare eligible. Again, there's 10,000 people who turn 65 every day in the United States, and that will continue to the year 2030. So today I want to talk a little bit about the logistics of what happens when you actually turn 65 and or become Medicare eligible. So there's a couple things that I'm going to recommend that you do. These are some things that I tell my clients. So number one, you have to set up a face-to-face appointment with Social Security. You can enroll in Medicare via the phone, via mail, or the internet. But as a best practice, I would recommend physically going to your local Social Security office and meeting with an agent. Okay, and here's why. Number one, if you're leaving a group employer plan, then you want to take a document that shows that you will be terminated from your group health insurance. So what this does is that it will save a lot of time and headache on the back end, proving that you are not eligible to be penalized under Social Security because you didn't have credible coverage. So you do have to prove that. Also, if you're not drawing Social Security, from a logistics standpoint, it just makes things a lot easier. So you have to sign up for Part A, and then you also have to sign up for Part B. If you are currently drawing Social Security before you turn 65, you'll automatically be enrolled in Medicare Part A and probably Medicare Part B. And so they'll just mail you out a card before your effective date, which is your birthday month when you turn 65. So what happens when you enroll in you earn Part A by working 40 quarters or 10 years. You have to enroll in Part B in order to be eligible to enroll into any additional Medicare insurance policies, and that's with every company. So if you only have Part A, you cannot get a Medicare Advantage plan, or you cannot get a Medicare supplemental insurance plan. So right now the Part B premium is $100 for your initial enrollment through through Social Security. So you have Part A and B. So when can a person actually enroll for additional Medicare insurance? So that would be a Medicare Advantage plan or a Medicare supplemental insurance plan. So you would be eligible to enroll during your initial enrollment period, IEP. So you have 3 months before your birthday month. So let's just say my birthday is in July 17th. I'll be turning 65 hypothetically. I'm able to enroll 3 months prior. So that would be April, May, June, and then my birthday month, and then I have 3 months afterwards to make a decision without having any penalties assessed to me. You're also, once you become Medicare eligible, you can actually enroll in a plan during OEP, which is the open enrollment period. That is actually between October 15th and December 7th. So you have that option actually every year. And then you can enroll during the year if you have what's called a SEP, which is a special election period. And so that would be if you lost employer coverage, you lost coverage with your current plan, you had a change of address, or maybe you're actually getting extra help from Social Security, or you're getting help from the state of Ohio, which will allow you to enroll into a Medicare plan outside Medicare eligible. As stated before, you need 5 consecutive years in the United States. You have to have worked 10 years or 40 quarters. That's how you earn Part A. Part B is optional. However, 99% of people have Part B. You have to pay an additional premium. Right now it's set at $104. So what does Part A cover? A good way to think about or remember what Part A covers is that anytime a person is lying down in a hospital bed overnight, that is what your Part A covers. So that would consist of inpatient hospitalization, skilled nursing. Medicare only covers 100 days of skilled nursing. After that, it's considered long-term care, and Medicare does not pay for long-term care in nursing homes. And then hospice is also covered under Part A. And then your first 3 pints of blood is also covered under Part A. So what does Part B cover? A good way to remember Part B are your doctor visits to your primary care provider, specialist, and anything that's outpatient related. So that would consist of ambulance services, lab work, MRIs, CAT scans, x-rays, and the emergency room. Okay, so once you have Part A and Part B, there's really 4 choices that you have as a Medicare beneficiary. Number 1, a person can stay on original Medicare. That's right now the system's fee-for-service. It's moving away from fee-for-service. I talked about that in some of my previous videos. Right now there's an 80-20 split. Medicare pays 80%. The Medicare beneficiary is responsible for the other 20%. Most people, there's a lot of people who still have original Medicare, but most people do not, because there is, in the event of a catastrophic expense, 20% could be a lot, could bankrupt someone. So the other choice would be is that you could stay on your employer plan. So I have some clients who are still working post 65 who have left their employer plans and decided to go with the Medicare Advantage or Medicare Supplement plan. And then I have people who I talk to on an everyday basis who are over 65 and want to determine whether or not they should leave their group coverage or what happens.